uh, undergraduate and also graduate program, and then some of our faculty member, and then practitioner professional from other cities and some other universities as well, like from South Sumatra, University of North Sumatra, University of Mataram, and others. So it's quite vary among institutions, but the disciplines all are related to health.
That's great. I hope my presentation is not going to be too technical, but I'll try to go slowly through the slides. I have 1 hour. Is it all right? 1 hour?
Yeah, it's okay. Yeah, we provide the time for lecturing about 40 to 60 minutes.
Okay.
And then after that, we will have a question answer discussion session. And yeah, hopefully before 4 p.m. Jakarta time, we will finish all of the general lecture session. So that you are not to still at 8 p.m. until 8 p.m. At Canberra time, right?
That's perfect. Perfect timing.
Your time for dinner.
Already, yes, that's right.
Okay, can we start? Admin udah oke? Kita mulai.
Oke, Pak.
Udah.
Ya.
Sudah terkontak dengan partisipan?
Ya, sudah. Partisipan sudah beberapa sudah proses join, Pak. Sedang proses join, insya Allah.
Ya. Kita mulai aja ya, nggak apa-apa ya.
Ya.
Oke, kita mulai saja. Good afternoon, everyone. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Pak Dr. Budi Hartono, Ketua Program Studi S2 di FKMUI Indonesia. Ladies and gentlemen, distinguished participants, welcome to our general lecture today. We have here Professor Sotiris Pardolakis from Australian National University. Thank you for your coming and joining, and as well as keeping our lecture, lecturing on this section. And as the agenda for today's general lecture, first day we will have welcoming or opening remark from Dr. Budi Hartono, the head of study program, master program. Yeah. And after that, I would like to lead the general lecture as the moderator, and I'd like to introduce Professor Sotiris to you all by reading his biodata. And then we'll have Professor Sotiris lecture for about 40 to 60 minutes. After that, we will have a discussion session. Probably we will divide it into several sessions, yeah, to more effective of the discussion. And after all of the discussion finished, then we will have closing remarks from Dr. Budi Hartono as well. Okay, we start with opening remark from Dr. Budi Hartono.
Yeah. Thank you, Prof. Budi Haryanto. Assalamualaikum warahmatullahi wabarakatuh.
Salam.
Selamat siang, good afternoon, ladies and gentlemen. The Honorable, the Speaker of the 41 Faculty of Public Health Online Seminar, Prof. Soteris Fardolakis, PhD from National Center for Epidemiology and Population Health, Australian National University. The moderator of this seminar, Prof. Dr. Budi Haryanto, our college lecturer and researcher from Faculty of Public Health, University Indonesia, University of South Sumatra, University of Mataram, Universitas Muhammadiyah, and also from hospital, and also from the staff of Ministry of Public Health, students of doctoral and master program, and all of the participants attending. We would like to say my gratitude beforehand for joining in the 41 Public Health Online Seminar despite the pandemic situation. This pandemic must have been a doomsday for most people, especially the ones who daily activities circulate in educational place. From the beginning of the COVID-19 pandemic in Indonesia, students, teachers, academics, civitas, and the particular are the ones to sacrifice. They have to stay at home, practicing social distancing, and do the teaching and learning activities online. All of the programs at the university are also have to be postponed or at least held online. On behalf of the Dean of Public Health, Faculty of Public Health, Universitas Indonesia, are honored and pleased to welcome all of the participants who still eager to learn in this difficult time. Moreover, the speaker who are willing to give the best to share their knowledge with the audience. The Public Health Online Seminar was used to be the part of the Faculty of Public Health Universitas Indonesia annual event. We hope all of the participants can absorb and much knowledge from the speakers. The last but not least, please stay healthy and keep practicing the health protocols advised. By this speech and saying Bismillahirrahmanirrahim, the 41 Public Health Online Seminar is officially open. Thank you and enjoy the activities. Wassalamualaikum warahmatullahi wabarakatuh.
Okay, thank you very much, Dr. Budi Hartono.
You're welcome, Prof.
Let me Okay. Okay. Before having Professor Soteris, let me introduce him to you all, distinguished participants. Professor Soteris Fardolakis is inaugural professor of global environmental health at the Australian National University, Canberra, Australia. At the National Center for Epidemiology and Population Health. This is like Faculty of Public Health in Indonesia, which he joined in September 2019, just 1 year ago. But before joining the ANU, Prof. Soteris was a director of research and head of the WHO World Health Organization Collaborating Center on Occupational Health at the Institute of Occupational Medicine in Edinburgh, United Kingdom. Dr. Soteris is founding co-chair of the International Consortium for Urban Environmental Health and Sustainability, and honorary professor at the European Center for Environment and Human Health at the University of Leicester Medical School. Previously, he was head for the Air Pollution and Climate Change Group and of the Environmental Change Department at Public Health England, and held academic position at the London School of Hygiene and Tropical Medicine and the University of Birmingham. He was one of the lead authors of the first UK climate change risk assessment and contributor to the National Adaptation Programme. He served as a member of the NICE and ICA, National Institute for Health and Care Excellence, United Kingdom, Public Health Advisory Committee on Air Pollution, and of the UK Royal College of Pediatricians and Childhood Health Group in Indoor Air Quality. Over the last 20 years, Professor Sotiris has advised national and local government and international organizations, such as for the World Health Organization, for the European Parliament, and for the UK government, for the Chinese Center for Disease Control and Prevention, and for the Australian Department of Health on the health effect of climate change and air pollution, and on environmental sustainability, health protection, occupational hygiene, and risk communication. Prof. Sotiris has been involved in numerous research projects, including field studies, environmental monitoring and modeling, epidemiology, risk assessment, and policy analysis in Europe, Africa, Asia, Australia, and the Pacific. Professor Sotiris' main research interests include climate change, air pollution, and health, sustainable cities, exposure assessment, environmental epidemiology, and public health communication and policy. He is specialty chief editor, Health and Cities for Frontiers in Sustainable Cities, and associate editor, Climate Change and Health for the International Journal of Environmental Research and Public Health. IJERP. Oh, okay, a good journal. Professor Seri frequently comments in the media and tweets at Sotiris5. Okay, oh. So Professor Sotiris exactly meet what the title of the general lecture today: climate change, air pollution, and public health. Professor Sotiris, time is yours.
Thank you very much for the generous introduction, Professor Budi Haryanto. We'd like to thank also Professor Budi Hartono for the introduction earlier.
Thank you.
And thank you all very much for the invitation to talk today to the distinguished audience. I'm very honored to be also visiting professor at the Universitas Indonesia for this term, and I look forward to interacting with as many researchers and practitioners from Indonesia as possible in this context. I will share my screen with you. So I hope you can see my slides.
Yeah.
Okay, so the talk today is going to be around climate change, air pollution, and public health. And I will touch on also on COVID, the COVID situation and the interactions with environmental health and sustainable development, and the opportunities and risks for benefits that we can bring to public health, but also risks for unintended consequences. This is an outline of my talk. So climate change and health will be the main theme. I will talk more specifically about the temperature effects on health. I will talk about air pollution, but also in the context of the very severe wildfires we had in Australia at the beginning of the year, and in the context of COVID-19. And also I will touch on climate change adaptation and give an example, if there is time, I'll give an example from a study we're doing in the Pacific, in the Pacific Ocean. So to put things in a context, climate change is happening, it's been happening for some time, it's clearly anthropogenic, and there is very strong evidence demonstrating that the climate is warming. You can see here, for example, the carbon dioxide concentrations going up consistently over more than half a century, nearly a century. And we have very clear evidence of other greenhouse gases also increasing, like methanes and nitrous oxide, in addition to carbon dioxide, which is the main greenhouse gas. There are a number of other observations indicating the global warming and the changes in climate, and that includes sea level rise, ocean acidification, shrinking of ice sheets, and more extreme weather events. Of course, the key marker, the key indicator of climate change is its temperature, and the increase in global average surface temperature over many years, over more than a century. And you can see here how temperature has increased globally from pre-industrial times to the current situation. This is on the vertical axis, you see the temperature anomaly. So whatever is over zero indicates an increase in the long-term average concentration, long-term average temperatures. So there is a clear increase, and this is becoming steeper in more recent years. This happens happening worldwide. So we have an increase in temperature in most parts of the world, both in over land masses and the ocean. And this creates a wide range of health effects. Some of these health effects are direct and some of them are indirect. So when we look at the impacts of climate change, in this diagram, we can see the drivers, which are in the middle. So the rise in temperatures, the more extreme weather events in relation to the temperature increases, the rising sea levels instigated by the melting of the ice sheets, and the increase in carbon dioxide levels in the atmosphere and also in seawater. So these drivers have impacts on the weather. We have more severe weather events like droughts and floods. We have changing air pollution patterns. We have changing vector ecology, so the changing patterns of mosquitoes, of other vectors which transmit infectious diseases. We have increasing allergens like pollen in the air, which cause allergies. And we have impacts on water quality, water and food security and supply, and also social impacts related to displacement and migration of people. And the extreme heat and extreme heat waves also cause direct impacts in terms of increase in mortality and morbidity, especially for the elderly. Some examples of heat waves and the impacts on health come from different parts of the world. So one of the best known examples is the European heat wave of 2003, which cost the life of around 70,000 people across Europe, mainly elderly people, many of them in France and Central Europe, but most countries in Northern and Western Europe and Central Europe were affected by this very severe heat wave. And this heat wave instigated many adaptation policies, heat wave plans in many parts of Europe, which aim to reduce the risk of heat on health, especially for population groups which are more at risk. Some other effects of climate change can be distributed in different ways across the world. So what you see here is a distribution of 4 climate-sensitive health effects, including coastal flooding, heat, and infectious diseases. And what you can see here is that when we add these climate-related risks together, we see a pattern which indicates that some of the poorest countries in the world are more hardly hit by climate change. So we see that the effects of climate change are more severe in Africa, sub-Saharan Africa in particular, Southern Asia, and Latin America. So those populations, those countries which are less able to adapt to climate change because of social issues, because of poverty, they are more hardly hit by the effects of climate change, like increasing temperatures, coastal flooding, and infectious diseases. So there is clearly an issue here with environmental justice and health equity. Some other impacts of climate change that I mentioned are wildfires and bushfires, as we call them in Australia, and had very severe bushfires earlier this year. Also floods and heat waves. So these are very typical extreme events that we experience in Australia. The problem is that the frequency and intensity of these extreme events is increasing. I will show you the map of average surface temperature in Australia over this century. So these are model data, temperature data, and you can see this is the predicted temperature for this time of the century, around 2020s. This is 2050s and this 2080s. And what you can see is that the warmest part of the country, the hotter part of the country, which is typically in the north, is expanding towards the south. So we have hotter temperatures covering a larger part of the continent as we go along the century. And this is driven by climate change. So the populations and the areas affected by higher temperatures are increasing in size. We carried out a risk assessment looking at the relative risk of heat mortality in different cities in Australia. These are the 5 biggest cities in Australia: Sydney, Melbourne, Brisbane, Adelaide, and Perth. And we assessed the risk of heat, which is on the right-hand side, and the risk of cold, which is on the left-hand side with the blue squares. And this is the increase in heat for 1 degree increase in temperature above the threshold. What you can see here is that obviously cold is increasing the risk of mortality, but also heat increases the risk of mortality. And what is interesting to observe is that in some places, the increase in risk due to heat is lower, and like in Melbourne here, and in some other cities, like in Brisbane, this increase in risk is much higher. And we try to understand these differences between cities. We try to understand why some cities are more at risk from heat than other cities, why some populations are more vulnerable to heat than others. And this might have to do with the housing conditions, with the way green space is distributed in the city, or with behavioral aspects. We calculated the impact of heat and cold in Australia over this century. And what you can see here on the top is the increase in mortality attributed to heat over the century. You can see here the increase is quite steep, but it is even steeper if we add population projections. So if we add to these calculations the increase in population, the increase in size of the population, and also the aging of the population, we see that this increase in mortality is even steeper. When we look at the mortality effects of cold, we see that there is a decrease in cold mortality, and this is because of the warming climate. But when we add to these projections the effect of population change, we see that this decrease is much smaller. So overall, the temperature impacts on mortality in Australia are indicating that we'll have more deaths associated with heat, and slightly less death associated with cold over the century. And this is a pattern which is consistent with many other places around the globe. When we look at the effects of temperature, this is the effects are not only associated with the direct impact on mortality, but also with impacts on morbidity, and also on impacts with impacts on ambulance services, on emergency services. So we carried out an analysis in London, in the UK, which indicated that when the temperature is going high, over 20-25 degrees, or when the temperature is very low, below 0 degrees, the ambulance services respond slower to any emergencies. So the effect of climate change, the effect of temperature, has an impact on the effectiveness and the response of the ambulance services in the UK. And this is a problem with the emergency services responding to emergency calls around in many cities around the world. So we see that the emergency services are affected by temperature increases or very low temperatures. There is an explanation to that. So we believe that when we have very high temperature, very low temperatures, we have many calls, we have more calls to ambulance services, but also the conditions in the road are worse. So we have floods, or we may have snow, or we may have conditions that prevent, other conditions that might prevent the ambulance services in reacting quickly. And we see the same pattern here when we look at the response within 8 minutes from a call to emergency services. Now, another aspect which is related to temperature effect is the urban heat island effect. So we know that in every city, the center of the city is usually hotter than the surrounding suburban and rural areas. And this is because of the materials used in the city, the construction, the traffic, and all the anthropogenic emissions of heat that you have in a big city. So we carried out an analysis looking at the impact of heat waves in a city in the UK, in Birmingham. And we look at the temperature during the 2003 heat wave, and also during a following heat wave in 2006. And what we saw here is that the center of the city, the effect of heat was much higher. So we have this urban heat island effect impacting on the center of the city, on populations, densely populated areas, which are people who are living in built-up areas within a city. And that this, of course, exacerbating the effect of temperature on mortality during these heat wave events. Of course, when we look at the effect of temperature on mortality, the effect of heat in particular, we know that the impacts on informal settlements are even higher. So we have significant impacts in built-up areas in high middle-income countries, or in places which are more affluent. But when we look at those impacts in urban slums, then we expect that the impacts there are much higher, although they're very hard to quantify due to the informality of those places. Also, there is increasing recognition that the impact of heat on outdoor workers is very significant. So agricultural workers or construction workers are affected, are exposed to the heat, especially in parts of the world where the temperatures can become very extreme, like in Southern Asia, Middle East, Africa. And this is increasing the problem for the economic development of those places. And there is a lot of productivity loss associated with the heat effect on workers. In terms of air pollution and climate change, I would like now to relate climate change to air pollution, which is an effect which is less direct than the effect of temperature. My apologies. I need to take my son out of the room. Just a second, please.
Yes. Yes.
Okay, my apologies about that.
It's okay.
So I will carry on talking about air pollution and climate change and the impact of air pollution. Just a second, I'm going to take another break. My apologies, please.
WFH.
Ternyata sama.
Risiko WFH.
Ternyata sama di seluruh dunia ya.
Sama. Disturbingnya luar biasa emang ini.
Anak-anak selalu ganggu. Sekarang soalnya di sana kan jam 6.
Oh iya.
Selisih 4 jam ya. Jam 7 lah.
Iya, iya.
Jadi waktunya anak-anak bikin dekat dengan orang tua.
Iya benar.
My apologies, ladies and gentlemen. These are the challenges of family
It's okay.
life.
Yeah, it's okay. It's quite the same within Indonesia as well.
Thank you for your patience. So we'll carry on with the lecture, and I will talk about air pollution and climate change now. Hopefully, with no interruptions going forward. So, climate change is affecting the pattern of wildfires globally, and that generates direct impacts on health due to fires and the heat on the fire front, but also affects many populations, many countries in terms of smoke exposure. I will talk about that in a moment. Also, the effect of climate change is affecting ground level ozone and black carbon, both of which are greenhouse gases, and they have an impact on the climate as well as on health directly. We know that ozone is a powerful respiratory irritant, in addition to being a powerful climate change agent. So climate change also results in longer seasons of pollen, and it increases the levels of aero allergens in the air, and that affects respiratory health. We know very well the short-term effects of air pollution, but we are working and trying to develop the evidence mainly on medium and longer-term effects of air pollution. And there is a lot of evidence emerging currently in relation to the effects of air pollution on endpoints, health endpoints like pregnancy, early life effects, and the effect on mental health and also on cardiovascular and respiratory health. So these are areas of emerging research, but the evidence is developing in this space. And of course, we're concerned always about the impact of air pollution on people with pre-existing illness, like people with asthma or chronic obstructive pulmonary disease. So this map shows you the global impact of outdoor air pollution on health. This is the impact of fine particles and ozone combined. And you can tell from this map which are the areas in the world which are more heavily affected. So you can see here the impacts in China, in India, but also in Indonesia and in Western Africa. So the effects of air pollution are very, very severe in terms of the global burden of disease. We know that around 7 million people die every year due to air pollution, and this is indoor and outdoor air pollution. We know that around half of the attributable deaths of outdoor air pollution occur in India and China. And of course, this is a very significant impact. It's around 1 in 9 deaths globally. So air pollution is one of the leading causes of disease and death globally, and we need to find effective policies to address this very severe health risk. Air pollution is very much related to urban areas. And you see here in this graph that over 80% of urban residents are exposed to air pollution levels that exceed the World Health Organization limit values. We did some analysis looking at different cities and the effect of the exposure, the PM2.5, the exposure to air pollution in relation to GDP per capita. And what you can see here is that some of the poorest cities in the world have the highest air pollution levels. You can see here in green, you see cities in India. The size of this bubble indicates the population size. You can see here in blue the cities in China, so at higher level of economic development, but also very high air pollution levels. And then you see this baseline of cities which are at higher level of economic development and GDP per capita, but again at the same time enjoying a cleaner environment. So we see this transition from very polluted places at the lower scale of economic development, and then the transition to a cleaner economy with lower concentration of air pollution. Now the key question is how we can transform these cities, how we can help this transition from a polluted urban environment to a cleaner environment through economic development, and also at the same time reduce carbon emissions, reduce anthropogenic carbon emissions, which are often associated with high-income economies. The other aspect I would like to highlight, we've seen the difference in air pollution levels in a range of cities across the world. When we look within a city, we have also significant difference in air pollution levels from one part of the city to the other. And here you see a few examples from Europe. That was part of a European project we carried out a few years back, comparing London in the UK, Stockholm in Sweden, and Athens in Greece. And you can see that part of the cities are much more polluted in the center typically, but not always. And the exposure of those populations, of those neighborhoods is much higher compared to other parts of the city. And we translate this, we convert this exposure level into mortality, and you can see again a similar effect on mortality. So the mortality associated with air pollution is unequal across the city. So there is an issue here with health equity, because some residents are exposed to much higher concentrations of pollution than other residents. We also carried out more recently a study in Thailand, and we looked at the impact of air pollution on different health endpoints, including lung cancer, COPD, respiratory diseases, systemic heart disease, and cardiovascular disease, cerebrovascular disease. And we quantified these impacts based on exposure-response relationships and the exposure levels, the exposure to PM2.5, to fine particles in the air. So the attributable fraction, the percentage of mortality attributed to air pollution was quite significant, as you see here. Some of the most affected areas are in the north, which are the areas where there is a lot of smoke from agricultural burning in winter, typically over the period of between January and March. And we know that this smoke affects also neighboring countries. So there is a lot of transboundary air pollution from agricultural burning and wildfires, which affect the broader region of Southeast Asia. And of course, part of the country, Bangkok and other bigger cities, are affected also by urban pollution due to traffic, domestic emissions, and industry. So it's a complex problem when we look at the different emission sources and the mitigation strategies. I would like to move on and talk very briefly about ozone, ground level ozone, which is another pollutant which is climate relevant. So we know that ozone is not emitted directly into the atmosphere; it's generated in the atmosphere from reactions between other pollutants like nitrogen oxides, volatile organic compounds, and carbon monoxide in the presence of sunlight. So when the temperatures are going up, like in the climate scenarios that we have at the moment, when we look at these climate projections, we are projecting also ozone to increase in certain parts of the world, and this because of the warming climate and the presence of other emissions of what we call the precursors of ozone in the atmosphere. So we carried out a study in the UK and also in Australia, around Sydney. That's a study published by colleagues from Australia, and we look at what is called the ozone penalty. So
you unmute this Prof. Sotiris. Yeah. We cannot hear you. You are unmute, or right now you are unmute.
okay, I hope you can hear me now. Apologies, I think I muted myself accidentally. So I was talking earlier about ozone pollution and the effect of temperature on ozone, the ozone penalty as we call it, in relation to climate change. And here I would like to highlight the impact of short-lived climate pollutants, including ozone, on the climate and human health. So we know that the main climate pollutant is carbon dioxide. We know that carbon dioxide warms the atmosphere and stays in the atmosphere for a very long period of time, over 100 years, potentially up to 1,000 years. So action on climate change to reduce carbon dioxide has an effect in the long term, but not an immediate effect on temperature or on human health. What has a more immediate effect is action to reduce the short-lived climate pollutants like black carbon, methane, ground level ozone, and hydrofluorocarbons. So these pollutants have a much shorter lifetime in the atmosphere, from a few days to a few years. And they also have a direct impact on health. So we know that ozone, as I said earlier, is a powerful respiratory irritant. Black carbon has an effect on cardiovascular and respiratory health and mortality. So we know that by reducing these short-lived climate pollutants, we improve health immediately, and we have a positive effect. Also, we bring a positive effect on the climate in the shorter to medium term. So it's important to act on short-lived climate pollutants, as well as on carbon dioxide, of course. In terms of interventions, what is important is to deal with air pollution and climate change in parallel, and make sure that the solutions we propose provide what we call win-win benefits. So provide benefits for climate change mitigation and also benefits for local air quality. What you can see in this graph is that some of the policies that we analyze can have positive benefits both for climate change and air quality, and these interventions are related to energy efficiency, are related to renewable energy like wind and solar, and carbon capture and storage. So these are win-win interventions, win-win policies. However, there are some other policies which are win-lose. So they might be good for the climate, but they're bad for local air quality. And just to give you an example, the use of biofuels or increasing the use of diesel cars, this might be good for local air quality. It might be good for climate change mitigation. It might have a benefit in terms of climate change mitigation, but it has a detrimental effect on local air quality because of the local emissions from burning biofuels or from burning biomass. Many of the interventions also to improve the environment, improve air quality, take place in the urban environment, in cities. So one of the crucial areas to improve is the quality of the urban environment. And this can have multiple benefits for health and and also the environment and the climate. What you can see here is some interventions that I won't have time to discuss in detail, which can have benefits for human health and climate and the environment. For example, here what you can see is white roofs. So these houses are fitted with white roofs, which reflect solar radiation and reduce overheating in these houses during periods of hot weather. We have other examples include wind energy, green roofs and green walls, low emission zones. So these are zones in a city where only vehicles that meet certain technological standards can enter. And we can see also other interventions like active travel, more infrastructure for cycling and walking in cities. And other interventions might be web-based or mobile-based. We can have apps which show us the less polluted way of getting to from work to home and or to educational establishment. So there are a number of interventions which can improve the environment and improve health in cities. Now I will move on to discuss wildfires, because it's very topical and a very current problem that we experience very severely in Australia and also in other parts of the world, in Southeast Asia, Western US in recent months. So what you can see here on these graphs is the change in frequency of wildfires and the change in length of the wildfire season under a climate change scenario, the RCP 8.5 climate change scenario. So what we can anticipate is that in a warming world, we'll have more wildfires, and they will last, and the wildfire season will last for longer. And this affecting most part of the world, as you can see here on this graph. It's a very widespread situation. What causes bushfires, so as we call them in Australia, wildfires, is the weather, but there are also other parameters like the vegetation and the terrain. And when we have these three factors converging, then we have wildfires, explosive and very severe wildfires in some cases, as those we experienced in Australia last summer. A way of measuring the forest fire risk is by using this fire danger index, which is widely used in Australia and in some other parts of the world. And this index combines the temperature, maximum temperature, a drought factor, wind speed, and relative humidity. It doesn't include a fuel load. It doesn't include the ignition source of fuel load, but indicates the impact of weather, the impact of the climate on the fire risk. And what you can see here on this graph is that when you look at the fire index, forest fire index over the last 40, 45 years or so, we can see that there is an increase. There is an increasing trend. There's a lot of variability, but there is also a clear increasing trend over this longer period of time. And this is because of increasing periods of drought and increasing temperatures. So what we can see here is what instigated the very severe wildfires we had in Australia earlier this year, in December and 2019 and January 2020. So we had record high temperatures across many parts of Australia, and we had record low rainfall. And these two parameters combined create these very high fire danger index rates, which obviously created an explosive situation in Australia, which resulted in unprecedented bushfires, affecting around 10 million people, especially in the east coast of Australia. So we had many people affected by the fires directly. So there were around 3,000 properties destroyed during the fires of what we call the Black Summer in Australia. We had 33 casualties, direct casualties, but many, many more people affected by the smoke. The smoke traveled very long distances across Australia and also across the Pacific. It was felt in New Zealand and also in Latin America. And as I said, it affected around 10 million people in eastern parts of Australia. In big cities like Sydney, Melbourne, Canberra were affected by the smoke over longer periods of time. So what you can see here is, this is Sydney and air quality levels in Sydney, unprecedented levels, very, very high concentrations, over 400 microns per meter cube. You see here the diurnal pattern, so with the concentrations peak during certain time of the day, but also decrease during other periods of time. So there was a quite strong variability in the concentration levels. And of course, we had fires, as you can see here, in most parts of Australia. This is some measurements which compare Canberra, the capital of Australia, which typically has very good air quality, with some of the most polluted cities in the world, in India, Mongolia, Pakistan, China. And you can see here that on the 2nd of January, Canberra was the most polluted city in the world. So you can see here that that's a handheld monitor that I was using at that time, and it was off the scale. So the concentrations exceeded 1,000 microns per meter cube. So the unprecedented levels of air pollution, especially for Australia. Colleagues have calculated the impacts associated with these extreme bushfires, and you can see here the PM2.5, the air pollution levels exceeding the long-term background concentration, and also the national guideline levels. And the mortality associated with that was around over 400 deaths across Australia, with more than 1,000 hospitalizations for cardiovascular causes associated with the smoke, and over 2,000 hospitalizations associated with respiratory causes, and over 1,300 emergency department attendances for asthma. So you can see here that the impact from the smoke was over an order of magnitude higher than the impact of the fires, in terms of direct impact of loss of life. Of course, we are particularly concerned about vulnerable groups, young children, the impact of the smoke on the elderly, those with existing illness, pregnant women, and outdoor workers. And we commented very extensively on the response of the public service and the response of the local authorities to these very severe levels of air pollution. So one of the issues we faced at that time was that the advice was inconsistent between different states in Australia, and we tried to improve the situation by providing additional advice around the use of face masks, around the parallel with tobacco smoke. So there was a lot of discussion on whether the exposure to air pollution was similar to smoking a few cigarettes a day or a packet of cigarettes a day. So there are some interesting parallels there. And also, we're asked to provide advice on physical exercise and whether people should avoid exercising during periods of air pollution, or whether they should take some additional precautions. So we published fact sheets and infographics in relation to the exposure to the smoke. And also we developed fact sheets in relation to the mental health of the smoke and wildfires, which are also very important aspect of the health impact. And we also translated these fact sheets into many languages, in 12 languages, including many Asian languages, and Thai was one of the languages we made translations into because there are communities, there are minority groups in Australia from these linguistic backgrounds, and also because we thought that these facts could be useful for in other countries. We are currently working to develop the evidence base. As I mentioned earlier, we have more evidence around the short-term effects of the smoke, but we are developing the evidence now about the medium to long-term effects. And this is effects on lung function, effects on pregnancies, and effects on mental health. I'll move on to discuss very briefly the combined effects of air pollution and COVID, which is obviously the other big emergence that we faced globally this year. And there is a lot of speculation about the combined effect of air pollution and COVID. the potential synergistic effect, and also the effect of the restrictions of the lockdowns on air quality in many parts of the world. So what you can see here is some results from a US study looking at PM2.5 levels in different districts, in different councils in the US, and also looking at mortality due to COVID per 1 million of population, again in the same counties in the US. The colleagues there carried out an analysis, statistical analysis of the COVID deaths and air pollution, and they identified that an increase of air pollution, an increase of PM2.5, 1 microgram, has a consequence an increase in the risk of dying from COVID, which is around 8%. So there was a statistically significant effect of air pollution, long-term exposure to air pollution on mortality, on COVID mortality. And you can see here the quantiles, you can see here the mortality ratios, the mortality rate for the highest quartile of air pollution, which is clearly significant here. So there is some evidence, although this evidence is not absolutely consistent across different countries. There is some evidence that air pollution, long-term exposure to air pollution may aggravate, may increase the risk of dying from COVID in a population. But of course, also COVID had some unintended, some unexpected effects on air quality. So the restrictions, the lockdowns brought much better air quality for a window of time to many countries. You can see here some pictures from India. So they were able, in the north of India, they were able to see the Himalaya in the background, the hands in the mountains due to air pollution for a very long time. You can see here deserted roads in China and Yuan, the epicenter of the crisis in the initial, in the start of the outbreaks. And also you can see here some pictures from Chile, again with the backdrop of the mountains very visible due to the improved air quality. These are some maps of nitrogen dioxide, which is one of the main traffic-related pollutants in Europe. So this is a map from satellite data in 2019. So that was the year before COVID, before the lockdowns, and you can see the same picture in the early months of this year. So you can see a clear decrease in NO2 levels due to the lockdowns over this period of time. Similar pictures from China, again with a clear decrease in nitrogen dioxide levels in China, in the northern part of the country, mainly during the lockdowns. However, that was the story in the first half of the year, and since then we have seen a rebound effect. So after the end of the more severe restrictions in the first part of the year, we saw an increase in road traffic. Many people many people choose not to use public transport because of the perceived risk or the real risk of infection in a shared public space. There is a higher use of private vehicles, and also there is a rebound effect in terms of carbon dioxide emissions from industry and the energy generation sector. So what we experience here is that this decrease in carbon dioxide emissions, this decrease in air pollution levels was short-lived, and it wasn't consolidated over a longer period of time. And this is a lesson we learn also from history. When we look at the other previous events, historical events like the first oil crisis in the 70s, or the dissolution of the Soviet Union in the late 80s and 90s, the Asian financial crisis in late 90s, and the global financial crisis, we see that there is always a decrease in carbon dioxide levels, carbon dioxide emissions, but then we almost always see a rebound effect. And this is likely to happen this time around. And of course, what we advocate very strongly is that we need structural changes in the economy. We need structural changes to reduce emissions sustainably in the long term. Now, if the time allows, I will go very briefly through some slides from a very exciting project we have in the Pacific Ocean, in the Marshall Islands. So we're helping the Ministry of Health of the Marshall Islands to develop a climate change adaptation policy focusing on the health sector. Marshall Islands are here, so in the middle of the Pacific, one of the most remote places in the world. It's a very beautiful cluster of very low-lying islands. So the elevation in most places, in most islands and atolls is less than 2 meters above sea level. And of course, the risk of sea level rise is very, very high and very real in these places. There are some engineering methods to try and prevent seawater intrusion into places which are inhabited by the local residents. And you can see that some of these seawalls are very, very rudimental, are made out of rubble or waste. So they're not really providing a significant significant protection against sea level rise. But there are also some engineering methods of providing a more robust protection against floods and seawater intrusion. However, the risk in this country, these very remote countries, is very complex because we have the immediate risk from the sea level rise, but we also have impacts associated with vectors like mosquitoes, zoonotic diseases, diseases associated with unsafe water and food, diarrheal diseases, and also very high levels of obesity and diabetes due to the loss of traditional ways of life and due to the loss of traditional nutritional sources. So we carried out community consultations and analysis of existing data in relation to weather, climate, but also infectious diseases and public health more broadly in the Marshall Islands. We looked into dengue outbreaks, another important risk factor in the Pacific. And also we looked into other infectious diseases and recent outbreaks. And we developed a range of strategies which focused on adaptation in the health sector, but also on public health adaptation more broadly. And that includes healthier food, healthier diets, opportunities for active travel, opportunities for more walking and cycling, adaptation and mitigation in the energy generation sector and also in the water sector. And of course, all this taking into account the need for better vaccination programs and better prevention of infectious diseases. So with this one, just to recap, we have seen the impacts of climate change. Some of them are better quantified than others. The trends are worrying, but of course, there are opportunities to mitigate climate change if we act quickly and if we act strategically in a range of sectors. No country, whether rich or poor, is immune to the health impacts of climate change. That was one of the conclusions of the recent report from the Lancet countdown report on health and climate change, which was published a few weeks back. The COVID situation, the pandemic, and climate change represent converging crises, as we saw in the case of air pollution. They can have synergistic compounding effects, but also they provide some opportunities, and aligning the global recovery from COVID with a robust response to climate change can provide a triple win situation with improved public health, a more sustainable economy, and better environmental protection. Of course, this is very relevant also to the risk of the forest fires that we saw this year, very, very pronounced and severe forest fires. So the risk is real in the short term as well as in the long term for public health. And of course, it's very important to connect all this agenda with the sustainable development goals and the opportunity they provide for more sustainable development across all sectors of the society and economy. So I will pause here. I would like to thank you very much for your attention and the opportunity to talk to the distinguished audience today. Bismillah, and thank you so much for the invitation to join your distinguished school as a visiting professor.
Okay, thank you, Prof. Sotris. Okay, please have a breath first. Okay, let's open the discussion for distinguished participant. Please, if you have a direct question, then we would like to ask directly to Professor Sotris. Welcome. We have actually one question in the question actually on the question Q&A box. The first question is from anonymous attendee to a form anonymous attendee, but it's okay. Let me translate it. After 5 years of Paris Agreement, what is actually the global action for climate change? Is there any progress or still going nowhere or anything? And then what is the effect of the global action since the United States of America is not joined anymore to the Paris Agreement? Okay.
Thank you for the questions. So the first question was, the last question was around the Paris Agreement and climate change mitigation.
Yeah, the progress of the Paris Agreement after 5 years now.
Thank you. I think we've seen progress, which is very different in different parts of the world. So there has been certain progress in a number of countries, but of course, some of the bigger polluters are not making us progress as we wish to see in this context. So, for example, my home country, Australia, is not making sufficient progress towards the Paris Agreement to mitigate climate change. And some of the bigger countries like China, Brazil, the US, importantly, haven't made as much progress as we would expect in terms to mitigate climate change in a decisive way. So there are some reductions in carbon dioxide emissions, which are mainly related to the transition from coal to gas. So the gasification of the electricity sector has provided some benefits. But of course, we need more decisive action in terms mainly in terms of renewable energy. So there are opportunities to very significantly increase renewable energy production and distribution in parts of the world like Southern Asia, Middle East, Australia, and also Europe and North America. So the renewable energy provides a very significant opportunity to mitigate climate change, but also to generate job opportunities, economic opportunities, and that can have multiple benefits for health, for the society, and the environment. So I think that's the important opportunity, the important action point for many countries to invest in renewable energy. And as we've seen from recent analysis, we need these kind of structural changes to capitalize on any changes in emission patterns which might be related to COVID-19.
Okay, and Is there any impact when United States of America not joining anymore to the Paris Agreement?
Of not changing? So, sorry, I couldn't hear the last bit.
Yeah, since United States of America is not follow the Paris Agreement,
So
is there any impact?
Absolutely. I think the impact of the current administration withdrawing from the Paris Agreement is very significant. But however, with the change in the leadership, the change in the U.S. administration, I think we're likely to see a very radical change in the right direction. So we know that President-elect Biden is committed to the Paris Agreement, is committed to climate action, and I think he mentioned that he will he will commit the U.S. Back into the Paris Agreement within 100 days from his presidency. So I think obviously this is a very hopeful message.
Okay, thank you. And then another question is, have you ever heard about the sun made in China? Sun, similar with the sun. Yeah, that made by China. And is there any effect to the climate change in the future?
Okay, so is that the effect of solar activity on climate change?
Yeah, it's like similar with the sun. Yeah, it's not solar activity, but the sun.
Sun exposure, the exposure to, okay. We discussed very extensively the effect of sun exposure, UV radiation, ultraviolet radiation on health, and how that might change due to climate change. Is that the question?
No, actually, China made duplicate of sun. Have you ever heard it?
I'm not sure.
They built the energy like sun.
Okay.
Yeah, just like sun, the duplicate of the sun, something like that.
Okay.
So now it's being used.
Okay, I'm not familiar with this. No, sorry.
Okay, it's okay. Okay, another comment actually. As you already presented that lockdown affected to the lower air pollution in the world.
The effect of lockdown.
Lockdown, yeah, the effect of lockdown, of course, decreasing of air pollution in the world. Okay, and what as our Indonesian experience, we are not using lockdown. We are having at the time with the SPB. The SPB is large scale social restriction. Yeah, large scale social restriction, which means that it's allowed for people to go outside using the transportation as well as the private car, for example. And then it seems that my experience, because I have also I always monitor the air quality in Jakarta, is no different between before and after SSR or SPP or lockdown quote unquote in Jakarta. It's quite different with you already presented in the PPT. Have you any comment on this?
So what we saw in many cities around the world was a decrease in nitrogen dioxide levels during the lockdowns, at least during the first period of lockdowns February, March, April. And this decrease was around, between 20 and 40% in some parts of the world. The decrease in fine particles in PM2.5 was much less, because it's a less specific pollutant to energy generation or road transport. So we saw less decrease in PM2.5. And of course, after that, there was a rebound effect. So in most places, the air quality levels are now back to what would be typically in this time of the year in previous years. So we didn't see a sustained reduction in air pollution, unfortunately. And I think this is a lesson, because we realized that unless we have structural changes in the economy, structural changes in transport, structural changes in energy generation, is unlikely that we'll see long-term improvement in air quality just because of a situation like the pandemic and the lockdown. So we need to have policies, long-term policies in place to improve the situation in terms of air quality.
Okay. Now we have also a question from Arina Nurul Ihsani. Thanks for the great presentation, Professor Seri. I'm interested with your slide about the act towards better or worse air quality. But as a consumer, we can only choose with the availability options that government provide us. For example, energy sources, transportation which may not come from the renewable energy resources. What is the win-win solution in this condition?
So the question is, what is the win-win
solution
in which situation? Could you please repeat?
Okay, but as consumer, we can only choose with the available options that government provide us: energy sources, transportation which may not come from the renewable energy resources.
I think this is a very good point. The individuals is very difficult to adjust, to change their mode of transport or change their housing conditions unless there is a legislative framework which allows that. So we need government policies which will provide the incentives, which will provide the framework that will promote this win-win solution. So we need better. We need opportunities for more renewable energy. For example, when it comes down to active travel, we need better infrastructure for cycling, better infrastructure for walking. We need infrastructure for electric vehicles. So this is an important intervention which cannot be done at the individual level. It's something that the government or local authorities need to invest in.
Okay, thank you. And we also have here a question from Novia. Novia right now is looking on the National Center for Green Hospital. National Center for Green Hospital. The question is, what impact would a green hospital bring to the climate change prevention? As environmental health workers in a national hospital, what could we do to contribute on preventing global climate change?
So that's a very good point. So the hospital sector, the healthcare sector is one of the biggest employers and one of the biggest emitters of carbon emissions globally. So in many countries, the health sector is one of the biggest components of the economy. And by reducing emissions from the health sector, then we can have an important improvement in the global emissions of a country. And there are practical interventions that can help reduce emissions from hospitals. So we know that many hospitals are not energy efficient, and in some countries, like in the UK, in other countries, there are specific teams which work towards interventions to make a hospital more sustainable, reduce, improve energy efficiency, reduce waste, improve recycling, reduce the use of equipment which is disposable and goes to waste after use. So there is a number of practical interventions which can help reduce emissions from the health sector. In addition to interventions in the hospital, also we can think about the way the primary healthcare is delivered, transport to primary healthcare providers, consultations. So there are opportunities for telemedicine, which will reduce traveling to healthcare providers, and that will reduce emissions of carbon and also emissions of local pollutants. So there is a wide range of interventions. There is a range of opportunities in the health sector to reduce emissions and reduce the impact of the sector on health and the impact on the environment.
Okay, thank you. And what is your opinion about the impact of malaria caused by climate change? Malaria and climate change. Yeah.
Okay. So malaria is obviously one of the key vector-borne diseases, and it's endemic in many parts of the world. It is affected by environmental factors like rainfall, droughts, and temperature. So it is a climate-sensitive infectious disease. And there is some evidence that climate change affecting the patterns of endemicity of malaria in a way which is similar to some extent with other infectious diseases, with other vector-borne diseases, mosquito-borne diseases like dengue or chikungunya or other diseases. So the ecology of malaria is the ecology of mosquito-transmitted disease is very complex, but they're clearly sensitive to climatic changes and to weather extremes like droughts, floods, and heat waves.
Okay, thank you. And I still have a question from the audience. This from Musrifah. Musfirah. Sorry. How to explain about primary impact air pollution to COVID-19? What about the incident cases, if any? So probably the question is attributable of air pollution impact to COVID-19.
So the air pollution impact on COVID-19 is very much debated at the moment. So as I pointed out with this US study, there is some analysis indicating that there is a synergistic effect, and this is very plausible because air pollutants affect the respiratory system, so they make us more sensitive, more vulnerable to infectious diseases. So we know that air pollution is associated with upper and lower respiratory infections. And so it's very plausible that exposure to air pollution, exposure to smoke makes us more susceptible to COVID. So it might make us more, it might increase the risk of contracting COVID, of get the infection in the first place, and also it might increase the risk of having a more severe manifestation of the disease. However, again, it's a complex interaction between COVID and air pollution, and I think it's still studied. We've seen a number of studies which were not very robust, some analysis which hasn't been very robust, or some studies haven't controlled for confounding factors, which we know are very important for the transmission of COVID. So I would say that the current evidence is that there is potentially synergistic effect, but we're unsure how much of that is actually happening.
Okay. Thank you, Professor Sapiri. Uh, there is no question from the audience. We still have time. Just waiting for the question from the participant. Dr. Budi Artono, do you have any question?
Yeah, thank you, Prof. Budi Arianto. Prof. Saturis, thank you for your great presentation, and I think it's a very interesting topics for our country. Related to our SDGs, yeah, as we know, we have 17 goals in our SDGs, and I think that global warming is have related with goals number I'm sorry number 11, sustainable cities, as you presentation, and sustainable city and communities, and number 12 is responsible consumption and production, and also for the number 13 it's a climate action. uh, how about your opinion that I mean that which the big frame of our program that we have to make some priority. It means that I think number 13, climate action, it's have it's itself it's impact of goals of number 11 and number 12. So I think it's we have success in number 11 and number 12. So I think it's climate action. It's hard to be comply of itself its goal self. How about your opinion?
Thank you, Professor Hartono. I
Yeah,
think this is a very good point. So we need to address many SDGs, maybe all the SDGs, to make progress in terms of climate change mitigation adaptation. As you said, SDG 11 on cities is very important. I think interventions in cities will be crucial for meeting climate change mitigation targets and adaptation targets. SDG 12, responsible consumption. SDG 7 on renewable energy is also very important. As I highlighted earlier, I think we need to much more decisive investment in the renewable energy sector. But the action on climate change actually is going to help many of the other SDGs, including SDG 3 on health, SDG 5 on gender equality. We know that for example, household pollution has an effect, a disproportionate effect on women, on female people in many countries. Economic growth, SDG 8 on good jobs and economic growth. You know, the renewable energy sector, the green economy sector provides opportunities for better employment and job creation. So there are win-wins there. And I think, you know, the other SDGs on justice, on environmental protection, on poverty also can provide opportunities for co-benefits in relation to climate change mitigation. So I think the SDG agenda, the Sustainable Development Goals, the agenda provides a very good framework for focusing our minds on actionable solutions in many sectors, which will benefit the environment, the climate, and human health.
Yeah. Okay, thank you. We have another question from Pak Suradi. Okay, let me read it. Based on the quadrant from Professor Sutiri's slide, to reach both of air quality and climate change benefits, there are some simultaneously actions that we can choose. For example, the using of renewable energy. Since Indonesia has rich varieties of natural resources, for example, wind, abundant solar, tidal, and so on. Based on your suggestion, how to prioritize, based on your suggestion, how to prioritize the chosen action to get optimal result.
So of course, action in different sectors need to be considered in the local context. So there will be opportunities. There will be some low-hanging fruits. There will be some opportunities to take action immediately in some areas, and there will be opportunities to implement policies in the longer term in other areas. So I think the opportunities around improved mobility, active travel are very important, and this is something that can provide immediate benefits for the environment and for climate and health. Opportunities related to nutrition are also very important, and I think need to be prioritized. So we know that a lot of carbon emissions, greenhouse gas emissions, come from the agriculture and food production sector. This includes carbon dioxide and methane, especially in relation to meat production. So for example, by adopting a leaner diet, richer in fruits and richer in vegetables and with less red meat, that significantly reduces emissions at household level and reduces the emissions from the agricultural and farming sector. So and of course this improves health immediately because of the reduced consumption of saturated fat and the opportunities for better cardiovascular health. So a lot of these interventions at individual level or community level, like better transport, more physical activity, better diet, have immediate benefits in terms of climate change mitigation, but also in terms of physical and mental health as well. So I would say that these are priorities. Of course, we need structural changes, as we said, in the energy sector, in the transport sector, in the housing sector, which will facilitate this transition to a greener economy, to an economy based on renewable energy rather than fossil fuels. Professor,
sorry. Yeah, sorry. We have one more question actually from Margareta. Dear Professor Sotiris, do you have any experience to work with communities, particularly young people, to support the prevention of climate change? If you do, could you please share that experience? Thank you.
Thank you. That's a very good question. So currently we have a network which is called CIFA. It stands for Clean Environment and Planetary Health in Asia. And this is a network of universities and communities in covering many Asian countries. The key partners are from Indonesia, Malaysia, China, and India. And we are linking with the local communities, with schools and teacher associations to promote climate change action at the local level and the community level. So for example, we run competitions, poster competitions, creative writing competitions with children advocating about the cleaner environment and better climate change mitigation effectively. So here in Australia, we also have a very strong engagement with schools around the bushfire risk and what happened last summer, exposure to smoke and air quality. And we're currently developing a picture book for children with some cartoons talking about the health effects of the bushfires, talking about the health risks and also mitigation health protection measures that individuals and families and kids can take to reduce the impacts of the smoke on health. So there are examples. I think it's very important and very empowering to work with local communities, especially with young children, the younger generations, with schools. And from our experience so far, we find them very receptive. So they are very keen to work with us um, to generate behavioral change, and also to spread the word, work with others to improve the local environment. Professor Budi, you are muted. I think you're still muted, Professor Budi. I cannot hear you.
Sorry. I was told that. Okay. There's a gratitude actually from Pak Surat. Pak Surat is working in the meteorological, climatology, and geophysics agency in Indonesia. That asking about the last question, before the last question, and he said that thank you, Professor Sotiris. Happy to hear a great lecture. I was also graduated from ANU Master of Climate Change in 2015.
Thank you. I hope you enjoyed your experience. You enjoy your stay.
Yeah. Okay. I think let me invite one more question from the audience. Is there any question? Okay, if no any question from the audience, then probably the general lecture today is finished. And very much thank you to Professor Sotiris. Thank you very much to all participants for very good discussion this afternoon. And let me finish the lecture, and I'd like to give back the stage to Dr. Budi Hartono. Please give applause to Professor Sotiris.
Thank you very much. Thank you for inviting me. I really enjoyed the lecture, and thank you very much for the great questions and the great audience. I'm particularly grateful to Professor Haryanto, Professor Hartono for the invitation, the introductions, and the questions and the discussion. And I look forward to discussing again and collaborating in the future. Thank you very much.
Okay. For a closing remark, please, Dr. Budi Hartono.
Yeah, okay. Thank you for this session. Thank you very much for your willingness to become a visiting professor to our Magister of Public Health Study Program, Faculty of Public Health Universitas Indonesia, and sharing knowledge that is very interested and useful in the context of socialization, and also for the comprehensive understanding about the impact of our climate change, to especially for environment and also for our health, and also for the extraordinary gratitude to Prof. Budi Haryanto, who has joined as a moderator in some series of our online public health seminar activities, and also for the participants who be joined in our seminar today. many thanks and also a great health and success for us. Thank you very much, and dengan mengucapkan alhamdulillah seminar online ini saya tutup. Thank you very much.
Thank you very much. Thank you. It's an honor and pleasure to collaborate and be a visiting professor at your distinguished university.
Yes.
And I look forward to more opportunities of interaction.
Yeah. Okay.
Thank you. Stay safe and happy end of the year.
Yeah, thank you very much.
Thank you very much.
Professor David. We still have another discussion. Yeah.